Hello, everyone. It's nice to be with Dr. Stephen May here. He's a keynote speaker on the upcoming International Spine and Knee Conference in Dubai on 17th of February. I was privileged to work with Dr. Stephen May for many years and to be mentored by him, to be honest. And Stephen is here today just to talk to us about your sessions in Dubai.
Yes, Mahmoud has asked me to do a couple of sessions. My main talk is going to be about centralization and directional preference, which are clinical phenomena related to the alteration of change and improvement in response to repeated movements or clinical input. These were terms that were first coined by Robin McKenzie, a New Zealand physiotherapist, quite a number of decades ago. Since he introduced that into the literature, into the physiotherapy world, if you like, there has been a lot of literature that has looked at these phenomena. They are very researchable, and I'm going to summarize some of that literature and also make clear their importance clinically. There are very few factors that you can use in your assessment clinical examination which can give you a clear indication about how that patient is going to do in response to what you give them. But centralization and directional preference are one of the few things that actually are link your physical examination procedures to their prognosis and how they're going to do in the long term. So I think it's an important clinical tool to people to be aware of and to be aware of the strength of evidence as well. So that was the first talk that I was going to give. And should I go on to talk about the other one?
Yeah, and definitely the centralization and direction preference session will be a fantastic introduction or set the scene for the other presentations that I'll be presenting, which is related to management of cervical spine. So because repeated movement testing, centralization, peripheralization, and direction preference is actually act as a fantastic approach to identify mechanical problems and also to identify the subgroups of the pain. Which guides the management of this subgroup.
Yes.
In addition to exercise, which will be another element that will be presented as part of the kinetic control concept. The other session is related to epidemiology.
Yes. So this is looking at a different set of evidence or a different area of evidence. I've always thought that it's very important to have an idea of patients beyond the clinic. Beyond how we see them in the narrow focus of on the day-to-day, and look at the perspective of their problem from the outside world, if you like, how they really are. And I think epidemiology gives us an insight into that around things like the prevalence and the natural history of something like low back pain. There's a lot of evidence around about that well over half the low back pain population have persistent or recurrent problems. This is something that needs to be built into our management guidance for these types of patients. What are they going to do when they do have a recurrence? What are they going to do when the problem gets worse again? And this is what the epidemiology tells us. And so to link the epidemiology to the management, I think is very important. And that's my other talk is going to be about low back pain, a bit about shoulder pain, but as I say, linking the epidemiology to the management.
I think the selection of low back pain and shoulder pain in particular, because they are two of the most recurrent and persistent musculoskeletal problems. When I travel teaching, these two problems in particular as a challenge for physios, because you are really good in giving them the first push on the treatment by doing our treatment tricks that people consider as a tricks.
Yeah.
But we always get surprised as these patients keep coming back again.
Yes.
Maybe understanding the epidemiology element of it may us change our attitude or belief about the management of this problem. It has to be a mixture of definitely hands-on exercise, but also self-management element. So
self-management is not a straightforward thing, but as long as we are trying to incorporate things that patients can include in their self-management strategies in the future, I think then we are providing true help, as opposed to something that you simply do to a patient It might make them feel better temporarily, but it's not any good for the next episode that they have.
Thank you so much, Steve. Looking forward to see you in Dubai. Thank you so much.